What's up, guys? Tyler Vaughn with Pathology Performance and a doctor of physical therapy at Refine PT and Performance in Daphne, Alabama. I wanted to answer a question today that I have received a lot lately with baseball season ramping up, and that is, should I, or for my child, ice for recovery or for injuries? And so the two biggest pieces at play here would be what we have all been following for the last forever, it seems like, which is the Price method, which is pressure, rest, ice, compression, elevation, okay? Or is there anything new that we should be following that's better supported in the research? And so today I want to talk about a new acronym that I did not come up with that is called Peace and Love. It was started in 2019 and basically talk about some of the new things with it that have been a little bit more controversial and why people have been resistant to change. Okay, so what does Peace and Love stand for? I'm gonna bring this up so you guys can see it. The peace part of it, and is just the connector, but peace is protect. Then we've got elevate, we've got avoid, anti-inflammatories, and ice. Okay, this is for acute injuries that this was originally come up with, but avoid, anti-inflammatories, and ice, or ice. We've got compress still, so that's gonna be the same, and educate, okay? And so I'm just gonna kind of step through the peace part of this, and then we'll talk about the love part of it afterwards. But this was released in 2019, so it's actually been around for a while, and that just kind of goes to show you how resistant to change the medical field can be, but also some things to keep in mind as far as not being too absolute on either end of the spectrum, because I do think that there's still some quality uses for some of this. But initially you've got protect, so that would be like in a tendon sense, like stress shielding. So we're going to basically continue to move, but protect that area from consistent pain or irritation or re-aggravation. You've got elevation, so getting that above the heart, whatever that area is above the heart if you can, to allow the body to reabsorb some of that fluid and continue to circulate and bring new blood to the area, hopefully limit some of that swelling. You've got avoid, anti-inflammatories, and ice, okay? And so the idea here is your body has a natural healing response, and part of that is inflammation, okay? So after there's an injury, new blood is sent to the area. That helps, angiogenesis, revascularization. You're bringing new things into the area, new healing factors, including things like macrophages, however you want to say it, which help to clean out some of the old stuff, or the damaged stuff. And so if you purposefully inhibit that, you could actually be delaying healing time. And there's also some stuff with ice as far as causing redundancy and collagen and some things that may delay the integrity of the tissue that's formed. And so is this something that I follow 100% of the time? Not necessarily, just because there are always circumstances that you have to kind of know the whole history and what's going on. But if there is pain in the area, this can still help. The icing can still help, right? It helps as an analgesic option. And so if we can use that to help with pain level to allow some of these other things to happen more, especially when we get into the love part with the load and with the exercise, and even necessarily with keeping people more optimistic about their pain level and how well they're going to respond, patient expectation, all those things play into my decision making. But in general, to know that taking these things, these anti-inflammatories, or using ice early every time just because, it is not actually what's recommended anymore. So just something to keep in mind. We've got compression. So that's something that we can use mechanically to gain tension in the area to prevent an excess or abundance of swelling, okay? And so if you want to mitigate that traffic jam, compression may be the best option versus going straight to the anti-inflammatories or straight to the ice pack, okay? And I know that a lot of the icing modalities will come with compression, like a Game Ready, and so that's where some of this is a little bit gray area, right? And so if somebody's had a good response to it in the past and it's mild aggravation or it's a post-pitching outing or something like that, potentially this still does have value, but to do it just to do it because that's what's always done, we just need to be better than that, okay? And so the next part is education, the understanding of these things that we're talking about, the understanding of how long an injury can take to heal. Those things will flow directly into the love part of this equation, which is understanding where to go from there, okay? So now the love part, all right, we've got load. This is probably the thing that we talk about the most in our clinic, which is we've got to get some kind of tension, mechanical stress on that area once it's tolerated, right? We go through the protection phase, we kind of move around it, we stress shield it, and then the next step is to reintroduce loading, right? For tendons especially, that really encourages proper healing, alignment of collagen fibers, all those good things that allow you to bounce back more quickly. And not to mention, this feeds forward directly into optimism, right? If somebody doesn't think that they can do anything, if you put them on the shelf it's hard to battle those feelings of depression or frustration or anxiety with how long it's going to take them to get back. We even see this after surgery, right? People think that they're never going to be back to full speed. And part of the process is the brain being willing to have an optimistic, or you allowing your brain to have an optimistic outlook on where you're headed, because that does impact your response, okay? So the next thing is vascularization, right? We want to promote movement so that we can get new blood flow in the area, and potentially even new blood vessels in the area, right? We want to reintroduce as much blood flow to the area as we can once we're outside of that very acute window where everything's just kind of traffic jammed up, right? So, and then the last piece is exercise, right? And that's kind of a feedback loop to the vascularization piece. But if we can overall, big picture, if we can stress shield somebody initially, allow them to protect the area and move around their discomfort, but keep them moving as much as we can, keep them optimistic, educate them about the process, and then slowly reintroduce graded loading and exercise, things respond much, much better on average, right? There's always the outlier, there's always the person that needs to be shut down a little bit more. This may not be the case for like a stress fracture, right? They may need to be in a boot, they may need to be off of this for a pretty good period of time, but in most cases for acute aggravation or something like that, introducing this style of thinking has been much more effective than going strictly to the pressure, rest, ice, compression, elevation piece. Okay, so the long answer is what you just got. The short answer is I am not going to ice just in order to recover or in order to decrease the chance of an injury being more long-term. That's not necessarily my thinking. I think the best place to go is increasing blood flow and introducing exercises that are non-painful. And that also follows along with the pitching piece, right? That was the specific question is, my son just threw yesterday, his shoulder's a little bit sore, should we ice him? And my response would be probably not, unless that's something that he has used effectively in the past. I would say let's get his heart rate up the day after, let's get him moving generally, let's increase blood flow, let's decrease some irritation, some pain. We're not pumping out lactic acid. I'll go over that and some other stuff that we talk about, but we are increasing blood flow to help with that healing process. So that's the long and the short of it. I hope that's helpful. If you have any questions, drop them in the comments. And if you've enjoyed this information, give me a follow, and I will continue to put out some clinical thoughts like this as we go forward. All right, thanks.